Okay, so we are going to discuss the arteries and veins of lower extremities. Lower extremities. So as you can see, we talked about the viscera, we talked about the vessels to the head and neck. Now let's go over the vessels of the lower extremities right here. Let me change the color here. Okay. All right. So first thing, let's enlarge it. Okay, we're starting with the abdominal aorta. We learned that already. We know abdominal aorta divides into right and left common iliac arteries. I'm just going to write the name on one end. Right and left common iliac arteries, which then splits into, here it's right external iliac artery, and here this is right internal iliac artery. What happens on right? Basically, follow the same branching on the left. So we are following the left external iliac artery. This is left external iliac artery. This is left external iliac artery. All right, so let's continue to follow. Left is external iliac artery as it enters the femoral area. Look at this is the femur. Basically, this becomes left femoral artery. This is also right femoral artery. I'm not writing it on right side. So right femoral artery continues on along the femur and behind the knees right here. So look at that here. So we're starting with left femoral artery behind the knees here. This is left popliteal artery behind the knees, popliteal artery. Popliteal artery then splits. It splits into anterior and posterior tibial and fibular. So notice we are following tibia here. This is tibia. So right here, this very first branching below the popliteal. This is the left anterior tibial artery. Then the next two branching are one basically tibial artery and fibular artery following the bones. So we know tibia is on the medial side, fibula is on the lateral side, and that's basically what we are looking at here. This is left fibular artery, while this is left posterior tibial artery. Okay. So we followed from the external iliac to femoral artery. Again, what goes on the left, the names are repeated on the right. Make sure that you're following that. The bilateral vessel. So left femoral artery, which then becomes left popliteal artery behind the knees. Then it branches into left anterior tibial right below the knee, then left posterior tibial on the medial side, and left fibular arteries. Basically posterior tibial and anterior tibial as well. So here on the right side, what we're looking at, this artery, this is the right anterior tibial artery. Both anterior and posterior tibial arteries feed into the arterial plantar arch. So you can call this right arterial plantar arch, and this is left arterial plantar arch. Okay. Then from the plantar arch, just like we saw for the upper extremity, from the plantar arches, so basically palmar arches and plantar arches, when it comes to the veins, rule of thumb, there are more veins than arteries. So when you are looking at the veins that are draining from the lower and upper extremities as well, you will have a set of veins that are called deep veins and a set of veins that are called superficial veins. So deep veins and superficial veins. These deep and superficial veins have a different naming systems. Deep veins share the name of the arteries: anterior tibial vein, posterior tibial vein, fibular vein. The superficial veins have different name. So the superficial veins, let's go over those. This model only shows the superficial veins. The Wehrman will show the deep vein, which I'll go over in a second. So the two superficial veins that you are seeing here on lateral and on medial. So the lateral side, right around the calf area, this is called small saphenous vein. Okay. Small saphenous vein goes up against the calf area and drains around the femoral. So it pretty much stops above the knee. The great saphenous vein. Great saphenous vein, which is the longest vein. So this is what I am tracing here. This is the great saphenous vein. And what you are seeing deep here, great saphenous vein basically goes all the way from the back of your foot around the Achilles area all the way to the groin area, the pelvic area. And the other vein that you are seeing right here, this one, I'll just change the color so that you have a different color for this. This one here. Basically, this is the femoral vein. Don't forget to mention right for small, great saphenous and femoral vein. Femoral and great saphenous vein join. Merge. Here you can see that we'll start from here. You got right, great, saphenous vein. I'm just abbreviating V for vein. And you got the right femoral vein. Basically, these two merge. And beyond that merging, this vein here, the pelvic area, this is the right external iliac vein. Now the names are going to be repeated. This tiny segment, this is right internal iliac vein. You can see the left external iliac and left internal iliac too. I'm not going to write all of that. So basically repeat what you can see here. If you can see the vessel, these are bilateral vessels. Just make sure that you have the right and left delineated. So internal and external iliac veins merge to form, this is left common iliac vein. We have the right common iliac vein too, you can see that. Both common iliac vein, this and this two, right plus left, merge to form or merge into inferior vena cava. That completes the name of the blood vessel, names of the blood vessels for the lower extremity on this model. I'm quickly going to show you the Wehrmann and the vessels on the Wehrmann model. So we'll start with this. I'm not using the slideshow mode because it's hard to see the pen. And it's a bit late at night. So, okay, so let's look at the Wehrmann model. Here we can, on the left, you see the arteries. On the right, you see the veins. So once you learn it on the other model, where you have the reference of the bones, etc., you can pretty much name it on the Wehrmann model. So we have lateral side, left fibular artery. This is left posterior tibial artery. This is left anterior tibial artery. Beyond the merging of the anterior tibial, here what you are seeing, this segment is the left, or rather branching popliteal artery. So popliteal artery has given rise to the anterior tibial, posterior tibial, fibular arteries. You see the left arterial plantar arches, okay, and you can see the femoral too, left femoral artery. I'm going to move this slightly to the left and erase the okay here. Okay, we got the arteries. Now let's go for the vein. Here, this model, this Wehrman model, this is where you can see the deep as well as the superficial veins. Recall, the superficial veins have different names, saphenous. The deep veins have the same name as the arteries. So starting with this kind of sticks out right here. Lateral, this is medial. So this would be right fibular vein. This is right posterior tibial vein. And here, this is right anterior tibial vein. Right there, merging. So here you see right popliteal vein beyond the merging of the tibials. That leaves us with these two. These two are the saphenous. Right, great saphenous vein. And this is right small saphenous vein. Now let's move that. So here we can see the vein. So what we saw in the model, the same thing. Basically, this is the right femoral vein. You can continue to see the right great saphenous vein. Femoral and great saphenous merge. Where they merge, this is right external iliac vein. This is left external iliac vein. Then you can see these two. Change the color here. This and here this. These two are right and left internal iliac veins. That makes this as well as this left common iliac vein. So, and that's right common iliac vein. the left and right common iliac vein join to form right there. That name is inferior vena cava. Here you can see the arteries. Basically, this is the abdominal aorta splitting into right and left together, common iliac arteries. Then you can see these two, this and this in green, right and left, external iliac arteries, while these two are right and left, internal iliac arteries. So we covered the arteries and veins both in the Wehrmann model. This is the Wehrmann model. Plus, we also covered the same vessels here in the flat circulatory model. Okay, so that's vessels of the lower extremity.